Today we are going to discuss mental health nursing documentation. As you can see, I already have typed up a narrative for mental health. It begins with the date and the time, and it reads 33-year-old involuntary male sitting in the day room alone. Blunt affect, disheveled. Patient is alert and oriented, times 4, speaks in low tone and at a slow rate. Patient reports still having SI. Patient refuses to discuss plan to this student nurse. Patient refused to contract for safety. At 8:15 a.m., this student nurse informed Professor Joan and patient nurse Jessica RN about patient SI, guarded behavior towards plan, and refusal to contract for safety. And it is signed A. Wilson, SN, ASU. Now let's discuss some of the material that is here. We have a date and a time. That is important. We always want to document the date and time that the assessment occurred. Anytime that you are documenting on a patient, whether it be mental health or med-surg or maternity, you always want to document a narrative in a way that the person who is reading it can actually visualize what is going on with this patient. I documented that the patient is a 33-year-old involuntary male. What exactly does involuntary mean? It means that the patient was admitted to the psych facility against his will. This could be because he was a danger to himself or a danger to other people, but he is involuntarily a patient there. Patient is sitting in the day room alone. What do you see? I will say this. Some of you may have already gone to mental health clinicals and some of you may have not. Some clinicals consist of students just talking to the patients and just observing and nothing really hands-on. Please don't ever think that you are not learning from observing. A lot of mental health consists of observing what is going on with the patient and also therapeutic communication, which is also a big part of mental health nursing. So, as you can see, I'm describing a lot of what I'm seeing with this patient. The patient is sitting alone. He has a blunt affect. Please learn your psych terminology. Blunt meaning that he's not showing a lot of emotions on his face. He's disheveled. That means that he's unkempt, that he may have on mismatched shoes or mismatched clothes, or that his clothes may be wrinkled or they may be dirty, that his hair may not be combed. Patient is alert and oriented, times 4, speaks in a low tone and at a slow rate. Moving very slowly or speaking slowly can be signs of depression. This is why this is important. Patient reports that he still has suicidal ideations. SI is the abbreviation for suicidal ideations. What are suicidal ideations? Suicidal ideations are thoughts that some patients may have of harming themselves. They are simply thoughts that pop up into their head. Patient refuses to discuss plan to this student nurse. Now, do I actually expect you all to go through all of this? Actually, no. I've taught quite a few psychiatric clinicals, and I've never had a student go through this. But if something were to happen and a patient disclosed this to you, it is so very important that you immediately tell someone that works there and that you tell your professor immediately. Patient refused to contract for safety. What does that mean? That means that you have asked the patient, do you promise to come tell someone who works here, someone who has a badge, if you have increased thoughts of hurting yourself? That may sound weird to a lot of people because you may be thinking, why would someone tell someone that they want to hurt themselves if they really want to hurt themselves? But truth is that you do have quite a few patients who actually really don't want to hurt themselves. They just may have these thoughts that pop up. And then maybe hours later, they're like, okay, I feel better. Not every patient actually really wants to harm themselves. They actually want help. That's why you have things like the suicide hotline. It is important to document what time that you inform someone. So as you can see, at 8:15 a.m., this student nurse Inform Professor Joan and patient nurse Jessica RN about patient SI, guarded behavior towards plan, and refusal to contract for safety. I'm documenting that, hey, I'm just a student. I don't work here. I told my professor, and I told someone who works at the facility, the patient's nurse specifically, that the patient has suicidal ideations, that the patient has guarded behavior towards plan. What does that mean? That means that the patient's not giving up a lot of information about the plan. It is important if you can find out what the plan is, because one reason of finding out what the plan is if that patient has access to something. If the patient is like, oh, I have suicidal ideations, I want to drive into a tree, the patient is there involuntarily, there's staff there, patient's not going to leave, the police brought the patient there, so the patient doesn't have a car, so you can say, hey, patient does not even have access to these means. But it is still important. If the patient was like, hey, I want to overdose on pills, and that's quite important at the psych facility because the nurse is giving the patient pills. You want to make sure that you check the patient's mouth for cheeking, which means that they are not holding pills in the corner of their mouth or underneath their tongue. That is an important aspect of psychiatric nursing. If you fear that someone has SI, make sure that you are checking their mouth to make sure that they swallowed their pills, that they're not cheeking pills, that they don't have any pills underneath their pillows or anything like that. Refusal to contract for safety. This simply means that the patient refused to say, hey, I'm going to come and tell you guys if I have increased thoughts of hurting myself. And as you can see, lastly, that it is signed, first initial of the student's name, full last name of the student, followed by SN, which means student nurse, and the abbreviations of the school, ASU. Many of you may be saying, hey, I can't wait till I get done with this class. I have no desire to work in mental health. But I do warn you right now that mental health will come to you no matter where you work. You can work in medical surgical, you can work in oncology, you can work in maternity, and you may have a patient that is suffering from a mental health disorder. So therefore, it is still very important that you are learning this information. You never know when you will need it. If you are on a medical surgical floor and your patient all of a sudden tells you that they're suicidal, how will you know what to do? This is why this information is important. Even though you may have no desire to work in mental health, you need to know that actions need to be taken to make sure that your patient is safe and that they do not harm themselves.